If you watch TV or check your social feeds, you probably know that we're having an epidemic of erectile dysfunction. And it's not just the 80-year-old man whose wife wants some action and he can't give it to her, but you see it now in 35-year-old men. What's with that? So let's talk about the possible causes of erectile dysfunction, because there are actually a lot of possible reasons. So where does it come from? Well, your blood vessels in your penis actually have to dilate dramatically on cue, if you will, to get lots more blood flow to get an erection. So it's dependent on the abilities of blood vessels to dilate dramatically and to dilate quickly. Now, we can measure the ability of blood vessels to dilate. Insurance used to pay for this great test that we did in our office called the endopat. Comes from Israel, and it literally uses some devices. We put little cuffs on your fingers, and we cut off the flow of blood to your arm for 5 minutes, and then we release it, and we watch how fast your blood vessels dilate. I'll give you a perfect example here in the LA area. Let's suppose it's in rush hour, and like always, there's a car accident, and the 8 lanes of the 405 are now funneled down to 1 or 2 lanes. And the cars build up behind the blockage. Now, if you're trying to get home, once that blockage is removed, once the accident is cleared, you'd really want the 405 to go from 2 lanes to 10 lanes so that you could get to where you're going quickly. And believe it or not, that's what we want to do when our blood vessels dilate. We want to go from 2 lanes to 10 lanes. So how does that happen? Well, number one, we want to make sure there's not a blockage that's causing it to go down to 2 lanes. So one of the possible causes, real causes of erectile dysfunction, is that there are blockages in the blood vessels in a man's groin that prevents any further blood flow. So what? Well, if you have blockages in your groin, you probably have blockages elsewhere in other blood vessels, like your heart. So one of the first things I do when I have a patient who asks for these medications, and I will use them, is I want a stress test to see if what's happening down there is happening in the heart. Because sadly, there are many instances where unbewittingly people took a drug to dilate their blood vessels, and it caused a heart attack because their blood pressure dropped. And I want to know who those people are because I want to do something about their heart. But the last thing I want to do is give them an erectile dysfunction medication. Now, number 2, we can also measure stiffness in blood vessels with blood tests. And they're fairly accurate. They can be impacted by infections, having a cold. They can, believe it or not, be impacted by having dental work, even tooth cleaning. Fun fact, every time you have tooth cleaning, you release about 2 billion bacteria into your bloodstream. Now, despite how scary that sounds, please keep getting your teeth clean. But we can measure the impact of those bacteria on flexibility in blood vessels. So one of the things I do with my patients is we look at those markers. One's called ADMA, and look at whether those are high and if we can modify them with diet or supplements. So those are the 2 main impacts. Where else can be a problem? Many patients are on heart medications, either blood pressure medications or heart medications because they have angina or have had a heart attack. And as a general rule, these are called beta blockers. And one of the things these drugs do is prevent this rapid onset of dilatation that you need to have an erection. And many times you need these beta blockers more than you need an erection. And sometimes we can work between the two as long as we know that there's no direct, two-lane highways causing the problem. Does diet have an impact? Well, absolutely. I've written papers that show that diet has a dramatic impact on the ability of blood vessels to dilate. And there is no question that the plant paradox lifestyle with supplements that allow dilatation of blood vessels has a big effect. We know that nitric oxide production has a big effect. For instance, we know that oral bacteria take precursors for nitric oxide that we eat and convert them into nitric oxide that dilates our blood vessels. And sadly, many toothpaste and mouthwash, which kill off oral bacteria, actually kill off the ability to make nitric oxide, which is how we dilate blood vessels, and really is how almost all of these erectile dysfunction drugs work. So the next question is, okay, so we've eliminated all the mischievous causes of erectile dysfunction. We've eliminated that you have heart disease. We've eliminated that there might be blockages in your blood vessels in your groin. So what? Is that okay to take Viagra or Cialis or any of the other ones? There are short-term uses like Viagra, and there are longer uses like Cialis. Now, there's one paper that is interesting in that these medications may have an effect on lessening dementia. Now, there's not enough long-term studies, but why would there be a correlation between these erectile dysfunction medications and dementia? Well, just like you'd like to get more blood flow to your penis, your brain would definitely like more blood flow. And it looks like that these medications not only help blood flow to your penis, but they may help blood flow to your brain. And so we don't know the cause and effect yet, but certainly more blood flow to your brain, probably a good idea. Does that mean you want to take it chronically? Well, most of these medications are not covered by Medicare or insurance. Sometimes we can get them covered. There is some evidence that low-dose Cialis affects BPH, shrinking a big prostate. So there may be other benefits besides the main thing you're looking for of taking these medications. On the other hand, remember that if the reason that you're not getting erection is because you're not getting more blood flow and you're using this as a crutch to get the thing you're looking for, you want to take action to see that the other parts of you, like your heart, like your brain, are getting it constantly rather than when you pop that blue pill. Because your heart and your brain want better blood flow 24 hours a day, not just on demand. And whenever I work with my patients for this problem, we have to understand that for most men, erectile dysfunction is just a warning sign of a much bigger problem that's happening throughout their bodies. And that working on the bigger problem may get us better action on the problem they came in for.